And so we're starting by looking at ventilation and the forces that are necessary for ventilation to occur, okay? So let's just kind of recap here for continuity. We were describing the atmospheric pressure to be very different depending on what latitude you were at. And so we mentioned that we're going to set atmospheric pressure at 0. And so there are two pressures that we can speak about in terms of looking at this. We can look at the absolute value, which is about 760. And then we can look at the relative value using that 0 as our reference point, okay? We then talked about the intra-alveolar pressure. This is the pressure of the air that's actually inside the alveoli. And this is the second component of our gradient, okay? So because we have the same principles applying here, the same bulk flow principles, we need to have a gradient in terms of atmospheric versus alveolar pressure. So the pressure in the alveoli needs to be either higher or lower than atmosphere, depending on whether we're in the expiratory or inspiratory phase of respiration. So during the inspiratory phase, we said that the number has to be a negative value. Again, we're comparing that to 0, and if it has to be less, right, from high to low, that has to be a negative value, meaning that alveolar pressure must be less than atmospheric. And for expiration, the opposite is true. That has to be a positive value, meaning that the alveolar pressure needs to be greater or bigger than the atmospheric pressure, which is 0. So that has to be anything above 0, okay? And just to remind ourselves here, the driving force for ventilation is that pressure gradient. So the difference between alveolar pressure and atmospheric pressure is the pressure gradient that we're referring to. Now we can also speak about the intrapleural pressure. This is the pressure inside that pleural sac, inside the pleural cavity. So that cavity that is lining both of our lungs. Luckily, they are not continuous, so they're lining each lung separately. So if there's some sort of pathology with one lung, the other lung is intact. Now the pressure inside the pleural cavity is always negative. It must always be negative in terms of referencing that atmospheric pressure, again, to be 0. And it's always going to be less than the alveolar pressure as well. Very, very important here. So if we look at the intrapleural pressure at rest, from that 0 being our resting place, the intrapleural pressure is usually -4 millimeters of mercury. Okay, and we'll describe how we get that -4 at rest, but typically it goes greater than that for inspiration and then slightly less than that for expiration. And we'll talk about that. Now the negative nature of the intrapleural pressure is what creates the distension of the lungs. It's also what keeps the lungs and the chest wall really closely adhered to each other. So typically the lungs have this natural tendency to want to recoil. Think about a balloon that hasn't been inflated. It wants to just kind of deflate on itself. And that's what the lungs want to do naturally. The chest wall, on the other hand, wants to do the opposite. Think about a spring, right? One of the spring that comes in your pens or something, and it wants to be expanded, right? And so the pleural cavity is standing in between those two structures. It's keeping the lung inflated and preventing it from deflating. And it's keeping the chest wall slightly adhered and preventing it from recoiling out. Okay, so the intrapleural pressure and the intrapleural space is what provides that surface tension to prevent the lungs from collapsing and the chest wall from recoiling outwards, okay, or pulling apart from each other. All right, so here we can see a better illustration of that, right? So this is our lungs. This blue is representing that pleural space in the pleural cavity, and then the chest wall is in orange, outlining all of that. So we can see the lungs are naturally wanting to recoil backwards. The chest wall wants to recoil in the opposite direction, and the pleural cavity is sitting adjacent to both these structures, and it has a negative pressure. This is why the intrapleural space must always have a negative pressure, right? If it has a positive pressure, it will now facilitate the recoiling of both those structures. So it always has to be negative, which creates this sort of suction in between these two structures and keeps them adhered to one another. So this is what happens when we do have interruption of the pleura. This is called a pneumothorax, and a pneumothorax is when air has been introduced into the pleural space. This is not good. This is not what we want, right? This is usually due to some type of injury, maybe a stab wound to the chest. Also, other things like emphysema, pneumonia can create this environment. And what we see is that the lung completely deflates on itself, right? It does what it wants to do, which is to recoil to its natural shape. And then